We're leaving today and entering a world of Mickey Mouse waving, princess meeting and greeting, lightsaber clashing, the Twilight Zone Tower of Terror dropping, Banshee flying, Space Mountain launching, Galaxy rewinding, what's the one that was Galaxy rewinding, fireworks igniting, world of other worlds, for whatever you love. Infinite worlds await at the most magical place on Earth, Walt Disney World Resort.
Start your day with Quaker Protein Instant Oatmeal. The Instant Oatmeal ready to help you tackle whatever your day brings, like wrangling your toddler into their car seat. That was fun. Coaching your 6th graders soccer team. Go girls! And carrying all the groceries in one trip. Whew. Try Quaker Protein Instant Oatmeal, granola, and bars. Great taste and a good source of protein. Quaker, bring out the good.
Well, hello there. I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. So last week, I kicked off my Behind the Badge type of episode where I'm looking at different nursing careers that aren't necessarily right there at the bedside and exploring what those are, because when I was a student, I really didn't have a lot of exposure to those alternative pathways, and I just find that really interesting, all the different things that a nurse can do. So I kicked that off last week talking about my role as a clinical nurse educator. So in this Mo's Monday Minute, we're going to be talking about teaching and learning, because even if you're not a specific clinical nurse educator, guess what you are at the bedside? You are an educator. You are teaching loads of patients, families, and also other nurses. But a lot of your teaching is to patients and their families. So one thing to understand is that most of the patients that we're caring for, that we're doing this teaching with, if we're teaching a family member, is they're going to be adult learners for the most part. Now, you could be doing a lot of teaching to adolescents and children based on, what's appropriate for their age, but you're also going to be teaching the parents as well. So even if you're a peds nurse, you're still teaching adults at some point and in a lot of different ways. So when we are caring for and teaching adult learners, really important to understand and remember that they really need to know the why. Like, why does this matter? So you need to directly make it relevant to their life, to their disease condition, to their surgery they had, whatever it is. And also just being aware that they're going to bring their own experiences, their own beliefs, their own fears into that, their own stress. Maybe they've had surgery, maybe they've had a below the knee amputation. So now we're bringing in, body image and acceptance or denial, all those types of things are coming into it. And patients in general are not going to learn well when they're feeling stressed, rushed, scared, unwell. If they can't breathe, they're not open to learning about COPD management, right? You're going to save that for later, and we'll talk about readiness in just a minute. So your takeaway right now is that a patient is going to learn best when the material directly applies to them. This is why we must assess readiness to learn as a big part of that. Because, again, like I said, if they are physically right now incapable of learning, we're not teaching them right now. If they are having an asthma exacerbation at this moment, I'm not pulling out their maintenance inhaler and their rescue inhaler and going over that with them. But as soon as they are ready to learn, 100%, we're going over that stuff. So physically able to learn. And then there's emotionally ready. Let's say you do have that patient who had the below the knee amputation. And right after surgery, in those first couple days, maybe they are very emotionally overwhelmed and distraught. They're not ready. They're definitely not ready for learning. Let's say that there's a tense situation with a family dynamic or goals of care conversations going on, and that's what everyone's focusing on. This might not be the right moment right now to talk about how to take a blood sugar, right? So you got to be very aware of the patient, the learner, their situation, their readiness to learn. Like read the room, okay? You'll get good at this the more you work with patients, obviously, and the more adept you get at this. All right, so that's first. They're adult learners. They're going to understand it. It's going to stick if it applies to them and if they're ready to learn. We also need to understand cognitive load and how patients or parents, caregivers can get overwhelmed really easily. First off, again, people are having a really bad day. They're in pain. They're anxious. They could be sleep deprived. They're processing a new diagnosis. They've had a below the knee amputation. This is a life changing thing. Or they've just been diagnosed with diabetes or heart failure. These are huge things to wrap your head around. They could even be on medications that affect their attention or their memory or that make them drowsy, and until they get their body kind of adjusts to those medications, they may have a hard time following. They may feel overwhelmed very easily. So, ability to absorb information can be limited when we're looking at it in that context. So, what are we going to do about it? We're not going to teach every single thing at once. And that is why you would never want to save all of the patients teaching, because when you're working in the hospital, there's like, here's the things you got to teach this patient before they go. You don't want to wait until it's time to discharge them and now you're teaching all of this stuff. Okay, you're not going to teach them all their meds, all the warning signs, when to call the doctor, how to care for their ostomy, how to take their blood sugar. Like, you're not doing that all at the same time. It's going to be very overwhelming. So you're going to have a plan for how this teaching is going to occur starting early. We start planning for discharge early. We start doing our discharge education immediately. So, teaching in those small, repeated doses throughout their stay is really going to reduce that cognitive load. It's going to improve retention and really help lessen those feelings of overwhelm when it comes to all the things that they need to know. So we're focusing on like 1 to 2 key things at a time, scaffolding. So maybe starting with a basic and then moving up to something a little bit more advanced and then a little bit more advanced. So let's say you had a patient with diabetes, newly diagnosed type 1 diabetes. This happens as adults. It's not just happen to kids. But let's say you have, or it could be a parent of a child with type 1 diabetes. Lots of things to learn, right? So a very basic thing to teach might be how to prick the finger. Okay, prick the finger, you do the rest of the blood sugar. Next time, it might be pricking the finger and then putting the droplet on and reading the result. Okay, then we're going to scaffold on top of that. What does this number mean? Do I need insulin? Do I need glucose? Like, learn for them to learn how to dose their medication. So, starting basic and then moving up to more complex things. That's a really good way to prevent that cognitive overload. All right, another key thing to know is that patients really do learn best when they're actively involved. You probably know this as a nurse or a student. When you can get in there and get your hands on stuff and do the thing, you're going to learn better. So this could be asking the patient to teach it back to you. Teach back is a very, very effective method for evaluating a patient's understanding. So have them explain it back to you in their own words. That way you can really see if they are understanding it. If it's a skill like taking a blood sugar, have them demonstrate it back. And encourage questions. You're not just giving information, you are encouraging questions as you go. Not like to test them, but just to confirm their understanding. And you also, with that, you're also assessing how the patient prefers to learn. If you say, okay, Bob, we're going to go over how to manage your blood sugar and do your finger stick testing and dial in your insulin dose. Do you like to see visual things? Will it help you more if I give you written instructions? How do you want to learn? And he'll say, oh man, I need you to write it down step by step. You'll give him those written instructions. You're also going to have him do return demonstration because it is a skill that he needs to learn. So again, teach back, having them do a return demo, really, really great way to assess their understanding and identify anything that needs to be reiterated. Now, one key thing to understand is that sometimes education is not the answer. Now, I'm not saying we're not educating our patients, but let's say you have a patient who keeps coming in for diabetic ketoacidosis, and it's like the third time you've seen this patient in the hospital with diabetic ketoacidosis. It might not be an education issue. Before assuming it is, it's worth looking a little deeper and asking if there is a barrier to care that is preventing the patient from following the information that they have been taught. Like maybe they can't afford insulin. Maybe they don't have a way to get to the pharmacy to pick up their insulin. Maybe they can't afford the Lancets. Maybe they have a fear of needles. I don't know, whatever it is. But there could be some big barriers that are not because they don't know what to do. It's just that they're not equipped with the how to do it. So in this case, you are looking at maybe bringing in social worker, case manager, somebody who can help them navigate these things to help remove like outside barriers to getting medication, for example. So again, quick overview of teaching and learning theory and how you will apply that a lot at the bedside. Because remember, as nurses, we're all teachers all the time. I hope this episode helped you, and I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Monster Energy. Everybody knows White Monster Zero Ultra. That's the OG. It kicked off this whole zero sugar energy drink thing. But Ultra is a whole lineup now. You've got Strawberry Dreams, Blue Hawaiian, Sunrise, and Vice Guava. And they all bring the Monster Energy punch. So if you've been living in the white can, branch out. Ultra's got a flavor for every vibe. And every single one is zero sugar. Tap the banner to learn more.